Hi, welcome. We're so glad that you've joined us today. Today, we're doing a session of our webinar series on the psychosocial support of NICU families. Today, we're going to be talking about staff education and support. So, all of these webinars that we're doing in this series are based on the recommendations for psychosocial support of NICU parents that the National Perinatal Association published in the Journal of Perinatology. When we went to start this idea and to create these recommendations, we knew that in order to make them effective, we really needed to bring together a diverse group of parents and providers. So I want you to know, just like today and with everything we do within our organizations, be it the National Perinatal Association or the Preemie Parent Alliance, we make sure that we bring together interdisciplinary teams, and some of the most important team members that we have are families. Once we had written the recommendations, we had them published so that we could share our work. You can find these recommendations published in the Journal of Perinatology. It was a special supplement of the Journal of Perinatology that was published at the end of 2015 and printed at the beginning of 2016. The really nice thing about this is if you go online, you'll see that all of the articles in this series for the special supplement are open access and available. So there's no paywall. Anybody can see them, download them, and use them. So I alluded to, when we sat down to make the recommendations, we realized that there were several domains, different areas that we wanted to focus on. And ultimately, we came up with these 6 areas of emphasis. If you are joining us for this webinar series, you might know that this is just one in a series of 7 webinars that we've done. So we have one on each of these topics you see here. And then we also have an introduction to the series that's done with our authors. But again, today we're going to be focusing on the recommendations for staff education and support. Some of our objectives today, we're going to talk about the why. Why are these things important? Why are they in the recommendations? What does the recommendations say? What do they cover? But more importantly, since we're doing this webinar series for people who are advocates and who are looking to make improvements in their NICU, we're focusing a lot on the how. So not just on what the evidence says and not just on what the recommendations tell us we should do, but how you actually take that information and use it to advocate for improvements in your hospital or in your unit. I'm your host, Erica Goyer. I'm with the National Perinatal Association. And today with me is my co-host, Tracy Pella, who's with the Preemie Parent Alliance. Tracy is the president and co-founder of an organization called Connected Forever that serves NICU families and bereaved families. She's also a member of the PPA Board of Directors. She's a licensed mental health therapist and a certified school psychologist. Our presenters, who we're so happy to have with us today, are Cheryl Milford and Christy Love. Cheryl has been so important in the creation and authoring of these articles that make up the recommendations for psychosocial support. That's because NICU is an area of expertise for Cheryl. She has spent many years as a neonatal psychologist and worked with staff and families in the NICU. She has a very good background in providing psychosocial interventions and supports. We're so fortunate at National Perinatal Association because right now she's our Director of Development and Outreach. But I also know that she is deeply involved in many of the initiatives that we are working on right now, including the staff education and support, and also advocating for mental health support in the NICU. Christy Love is the Director of Operations for the National Perinatal Association, but one of the reasons we have her here today is Christy's not just the mom of 2 preemies, a daughter who was born at 35 weeks and a son who was born at 30, but she has years and years of experience working with hospital staff, much of it at Mercy Children's Hospital in St. Louis, where for years she was a NICU family advocate. Before that, she's a volunteer. She continues to be a volunteer, and she continues to be just an amazing advocate for NICU families. We've been fortunate enough to have her as a part of the NPA since 2009. She currently is working as our Senior Director of Operations. And Christy also has newly accepted the role as the President of the Preemie Parent Alliance. So we're very, very excited about again, this collaboration between our two organizations and how natural it is for us to work together. So I guess we start really with the fundamental question, which is why is NICU staff education important? Why is supporting your NICU staff important? And so Cheryl, can you tell us a little bit about this topic in general before we start to talk about some of the specifics of what's in the recommendations?
Certainly, and I'm happy to be here with you today to talk about this very important part of the NICU that frequently in the past has not been addressed, and that is that staff have to need education regarding their work with parents and their work with families. Um, and that is just as important as they are to learn how to take care of the babies. The other thing is that it has been known for years, and there's now research to validate it, that the NICU is a very difficult place to work. It can be stressful. Um, and so it's helping to teach staff to help families. And also, it's very important that we help staff learn how to engage in team building and self care and all the things that give them the support they need, um, so that they feel nurtured so they can nurture the families and the babies.
I know I mean, it's one of the things we've talked about so much, and I think it really happens in a lot of professions, but especially, in medicine, especially in the NICU, is oftentimes professionals are trained for one job and, get so much information and training and practice at the skills of delivering medical care, but really day to day, there's so much more they need to know beyond just the medical stuff. And do what sort of insights can you share with us about what um, staff might need to know that they don't yet know when they first come into a NICU? What would the recommendations say are important things for us to be talking to them about?
The recommendations make it very clear that staff need to have skills of active listening and to have language that is supportive of families. Um, the recommendations also are very clear about respecting the families as the primary caregivers, um, and that staff are there to support parents in that role. And that is a significant change from where we were when I started in NICUs 35 years ago. Um, so the important difference is we've now over time brought the model of caregiving to not just taking care of the baby but taking care of the entire family, and that's the part of the guidelines regarding staff education and support that are so critical. Is once you can work with staff and help them to see what they can do to make things better for the families, it also helps to make them feel more confident in their role. And additionally, helping nurses and all professionals in the NICU to realize that they have to take care of themselves so that they can have a full and rich life, not only professionally, but personally.
I think that's fascinating because you kind of started to talk about too about how the staff is a team who has to work with each other. They have to take care of themselves. They have to take care of each other. But then, as that's going on, kind of within the unit, they then have to present to families out in the NICU and play this role as support for them, and it requires, I think, some insights and some discipline to be able to do that. And I think so much about, neonatology is a relatively young field, and yet, so there are people who probably started working in the NICUs when parents weren't there, and now they are. So it also makes me think about, what. traditionally NICU staff education has been, a lot of online things. You have to remain up to date on certain procedures. You have to learn about new ones. So when we're talking about staff education like this, there's an important difference, I imagine, than all that other sort of education people do.
That's absolutely true, Erica. What we do in terms, especially with new staff coming on board in the NICU, is yes, they get all the training and mentoring around the other things, but now they also get training and mentoring around how to interact with families and y- you know how to use language is really critical, and so how to use language appropriately, being respectful, understanding how to de-escalate situations that may be getting difficult, because it's really hard to have a baby in the NICU.
Yeah.
And it's a situation where parents are on a roller coaster. And
Mhm.
once staff understands that and can support families as they go through all the challenges of the NICU and their baby's medical condition, um, the support that the staff provides can make it. It's certainly not going to be a wonderful experience, but can
Yeah, no,
support families to be able to handle the situation in the best possible manner.
yeah. Thank you for those insights. No, I think that's very interesting, and it makes me, can you give us some examples of different skills that staff might need to develop or behaviors that they might need to change? You know, um, like in these three different areas. Can you give us an example of what a best practice might be in each of these?
For interactions with families, one of the most important things is helping staff to work well with families who are not like them, may not
Mm,
be of the same culture, may um, the staff might be initially uncomfortable with how the family talks and the language they use and that type of thing. So it's really helping staff to understand how to interact with families across the board.
right,
In terms of self-care, it's the basics that really help with their behavioral change and support them, such as good sleep hygiene, good nutrition, exercise, having a positive attitude. All of those things are highly recommended, not only within the guidelines, but in all other literature about especially intensive care staff taking care of themselves. And then it's really important that they function as a team and they support each other. And examples of that are having debriefing sessions after a difficult situation, celebrating professional achievements, um, and just really making the NICU a place where the staff feel safe, um, and that they can support each other.
yeah. No, that's so important, especially because we know how many different types of people work in the NICU, and it's interdisciplinary, and sometimes you have people coming and going. So I imagine you really need a staff that can work well together. And so, how do you do that?
Well, some of it is by taking this statement and making it the core of the team culture, which is supporting the staff so they can support families. And that comes from the top, from hospital administration all the way through to NICU administration. And it needs to be a core value of staff members in um, the NICU. And a lot of ways they do this is each NICU has a different culture. So they look at what their culture is and they determine how they take care of each other. And a lot of times, uh, after 35 years of working in the NICU, food is like one of the best fellowship things and good for
Yeah,
staff. So they'll have potlucks, they'll have luncheon celebrations. all those things that bring them together. So and people always say, well, food is just a little thing. It is not a
Um,
little thing. There's a reason parents
yeah,
bring food to the staff.
yeah. It's like the same way food is in families and stuff. That's
Hmm.
brilliant. Thank you so much for those insights, Cheryl.
Christy, will you share with us why this particular project was important for you to work on?
Yes, Tracy, I support families every day during their NICU journey, and taking care of our caretakers helps our families and babies have better outcomes once they leave the NICU. We also see, I'm currently working on national guidelines for the NICU, discharge planning, and transitioning to home. We take wonderful care of our families while they're in the NICU, but we fail to prepare them to succeed once that they go home.
How important is the relationship between the NICU parent and their baby's caregivers, most notably the bedside nurses that they interact with every day?
Oh man, it's very important that families feel nurtured and compassion from their baby's caretakers. It's what builds their trust. It makes them feel that it is safe to leave their little ones. The more trust the parents have for their baby's caretakers, the more relaxed the parents are. Parents react to the environment that they are put in.
So, how are decisions made even about what sort of education support staff get? Cheryl, you have some insights into this, having worked in NICUs over time. How are decisions made about what sort of staff education is done?
Every new staff member who comes into the NICU, including the physicians, by the way, um, has to go through a training program um, that addresses not only the medical um, needs of the baby, but also the needs of the parents. And so, in most units, especially units that are academic hospitals, what you find is that there is a training period, usually anywhere from 8 to 12 weeks,
Mm,
where they learn all the equipment, they learn all about the various diagnoses and how to support babies who are very premature versus full term infants. And then, and that used to be it.
yeah.
Um, and then in the last, I would say, 20 years, it's evolved where the program that they go through provides them with education on taking care of families and making sure that they understand how the families are part of their care unit. It is not, they're not just taking care of the baby, they're taking care of the family.
Yeah, that makes me think about almost when I choose my own providers, or when I looked at the providers who cared for my kiddos, it was sometimes you want the staff person who is just really good technically and knows how to put in that IV or do that blood draw or whatever it is. Sometimes you want somebody who's just really technically proficient, and that's probably what most people focused on, during their education. But then now there's a whole other side of things, which is that interpersonal stuff. Sometimes on a particular day, I need somebody who's just really intuitive and smart and in tune. So how would you say that those different, both the psychosocial skills, it sounds like they're really necessary in order to complement whatever medical skills you might have.
At this point in time, where we are in the practice of neonatology and care in the NICU, the priorities are caring and giving the optimal medical nursing care to the infant, and just as important is the psychosocial issues. So we now see many more social workers and psychologists in the NICU who are there not only for the families but for the staff.
Right.
Chaplains are very important, and there are many hospitals now who have chaplains who've been trained in terms of dealing with the NICU experience for families and for staff. So making sure there's enough of those in, people who can help staff with being intuitive, but it can also help staff when they may be struggling. There are situations where there are very challenging difficulties with the baby and trying to support the parents
Yeah.
when it's such a challenge for the staff, really teaching how to make those two things work together well so that everybody feels supported.
Yeah, no doubt. I mean, it's a very difficult job, and you're in there, you're giving care, but you're giving in this environment where, you know, it's life and death so much of the time, and it also makes me think about, how much now patient satisfaction is going to be more and more important.
Well, that's one of the things that's really driven being able to get the psychosocial guidelines into practice in units is because patient satisfaction. In this case, our babies cannot fill
Right.
out
Right.
the patient satisfaction, so it's the family. And in
Yeah.
reality, that's really good because the family can provide valuable information in terms of what was helpful to them and what was not helpful to them. Um, and a lot of times when you have mental health professionals in the unit, you get that information in real time and you can help to
Mm, right.
support the staff and the family
Right.
as they're dealing with this.
No, that's very, very smart. You're right. I mean, being able to see things that are going on and address them so that the care is as good as possible. Thank you. That was very, very helpful. So what I hear you saying is that maybe this new shift into looking at what the family's experience was when they were in the NICU, do do you think that changes how hospital administrators or NICU leadership looks at something like the recommendations for psychosocial support?
Oh, I think absolutely. And one of the issues is that I have worked with NICUs where leaders, the staff completely understood what they needed to do based on the guidelines because they'd gone to an NPA conference or some other conference where the guidelines were discussed. Um, the way you bring leadership into this is not only patient satisfaction, but retention of staff because
Oh,
it's very expensive to train an
yeah.
NICU nurse or a respiratory therapist, and their job depends on the fact that they retain their staff and that their families are happy. So it's gotten easier and easier over the last few years to help them to understand why this is so important. Um, and you said earlier there are people who are still working in the NICU who started in the NICU in the late 70s, early
Yeah.
80s when,
Yeah.
families were not there. But what I find is once they understand the rationale for why things are going the way they are and the change that is happening in NICUs with regards to staff education and support, they're usually the ones who are become the biggest champions because they understand what the past was like.
Mm. It's certainly an incentive to start providing better care and to adopt these sorts of best practices.
Absolutely.
So we've really heard how important it is for NICU staff to not just support the baby's medical needs, but also the psychosocial supports that are necessary for the families of the NICU baby. So, Christy, tell us, do you feel like NICU staff is ever really prepared to support the psychosocial needs of NICU parents?
Is anyone really prepared for a NICU experience, professionally or family? I always ask myself that question. And it always comes, we watch new NICU staff be mentored by experienced staff. Providing psychosocial support of parents is rarely discussed during fellowship. And I really think that that comes with experience and education. And that's, again, why the recommendations is a great resource to use.
So, without having that proper training and feeling that preparedness to support NICU families in that psychosocial area, we've all seen that that can often lead to burnout. Have you ever seen how staff burnout has negatively impacted a family?
I have. I know it's not intentional, but I have seen staff be a little less patient and short with families. This can easily be taken personal by the families, as well as cause a family a little more anxiety to leave the NICU and go back to work or home or to their other children. As recommended in the guidelines, again, we recommend to families and coworkers to discuss their concerns with NICU leadership.
Just like you said, Christy, we know that, these are often not intentional interactions that NICU staff has with families. So what are some steps that we could help to help the staff be more prepared for these, situations and to support families in the NICU?
I would have to say utilizing the guidelines as part of the staff education, and by providing staff education on staff self-care and supporting their coworkers. We have to remember to take care of our caretakers. NICU administrators need to understand the psychosocial needs for parents supporting their staff and providing the recommendations.
It's so interesting because it just keeps kind of coming back to me how much of a difference there is between sometimes what people think the job in the NICU is going to be like and then what it's actually like. And like you said, Christy, it kind of parallels, is anyone ever really prepared? So then you think about, families and what they thought things were going to be like versus what they are now is so different. I feel like we leave maybe some of our providers, woefully unprepared. Cheryl, you started to talk about even just debriefing. We know that bad things can happen in the NICU. Fantastic things can happen in the NICU. And sometimes you have your best day and your worst day in the NICU, and they're the same day because you're caring for different babies and different families. So say I'm a new student, a new nurse, a new provider, a new neonatologist, and I don't know what support I need. I don't think I'm getting it, but what can I do?
Well, this is always one of the biggest challenges, and we deal with this frequently at MPA when our conferences, when these staff people come up to us and say, we're not doing this, and this, and we have problems because of it. I think one of the challenges is, and I always tell people who want to go back and be a champion, is this is current standard of care in the United States. This has been, it's all evidence based, and it has been accepted by major NICUs, a lot of the academic NICUs. So part of it is definitely looking at the fact that this is part of modern neonatology. The other thing is that these individuals can be modeled, and they can take on the role of sticking to the guidelines and talking to their fellow staff members and talking to the leadership. I always found, and I always recommend to nurses, look at your data on family satisfaction, length of stay, and staff retention,
Right.
because those are the areas that all members of administration, from the hospital administration and the board of directors down to all the unit directors, look at. And if you have that data and you can validate, look, this is where we are now, and look at the research that's been done that shows this will change us so that we will have decreased length of stay and increased patient satisfaction, and you won't have staff leaving.
Yeah.
That works really well. It has to, a lot of times it's a grassroots situation, unless somebody from administration has gone to a conference and looked at all of the things that are going on nationally with regards to psychosocial support of parents. The hardest one has been all along, I have to tell you, is the self-care component. Healthcare providers have a really hard time taking care of themselves. Yeah. And that's one of the big ones in terms of looking at staff retention.
No, I think you're right. I mean, can you elaborate on that a little bit more? I think about kind of the culture within medicine, and especially among nurses, that kind of some of the beliefs that have counteracted the this understanding that they really need to do. You can't be a good nurse if you're not taking care of yourself. You can't be a good provider if you're not taking care of yourself. And yet, we hear about people not taking breaks to go to the bathroom.
Yeah. And the reality is back in 1983 when I started in the NICU, the good nurse was the one who never got a break, never got lunch, never got to go to the bathroom. And as a mental health professional, I found it appalling from the very beginning. Um, and so it's taken a long time to try to change that
Yeah,
concept and culture of, the only that if you're just wearing yourself down to death, that means you're a good healthcare professional. It's not just in the NICU, it's everywhere. So
yeah,
there is movement in nursing schools and medical schools. And I know there's several programs in respiratory therapy who are now have required courses on self-care. So it's a transition we're making. Is it happening as quickly as I would like? No.
right.
But, there are lots of us out there advocating for self-care for healthcare professionals.
Yeah. Well, it just makes me think more and more about how, NICUs will often invest a lot of money in redesign and in architecture and in new equipment. And all of those things are very important and matter a lot. But it still just seems like the most valuable asset, the most valuable resource that you have in your NICU is the people in it.
Absolutely. And the thing is it's we are changing the culture, and that's one of the things that MPA continues to work on very hard is helping the entire healthcare system understand the needs of not only families but of the staff who take care of them.
Yeah. Thank you.
So, as we've heard, we know that several NICUs across the nation are adapting. The guidelines are really making a focus on the psychosocial supports of parents. Share with us, what are your hopes for the evolution of NICU staff education and support?
The guidelines had made major changes for caring for families in the NICU, and I would like to see more staff support for the challenges that they face in the NICU. From day to day, you don't know what your day is going to look like as a NICU staff member.
And Cheryl, what would you say if you had like that proverbial magic wand and you could like change something? What would you change, or what change are you seeing that you're really excited about?
I was a psychologist in the NICU for 35 years, and there weren't a whole bunch of us, especially when I started out. And now we have evolving in psychology now programs to train NICU psychologists. And one of the things MPA has done is put together a group of psychologists who are working in NICUs. They're called the MPA Network of NICU Psychologists. So we brought them all together, and they are doing amazing work in looking at what the training and guidelines have to be for families and looking at perinatal mental health disorders that can occur in the NICU, and also in how to help these families after discharge. Um, so now we even have university hospitals that are offering postdoctoral um, internships in NICU psychology. So I see that as being a huge part of what's going to help in moving us forward.
Oh, I have to tell you, I've learned so much from you, and also, during this webinar series, we've also talked to Dr. Sage Saxton and Dr. Mike Heinen about the work that they've done, and I know that you know both of them very well, but the work that y'all are doing about screening and mental health support and everything is really exciting, and I hope people will go and explore some of the resources we have available for, and that we're going to continue. I'm just so thrilled and excited about the potential for what sort of resources, program support that are going to come out of those initiatives and out of that work of the NICU psychologists. And this has been such a great discussion, and we've covered so much. So I want to say, Christy, if there were one thing that you wanted people to remember from this discussion, what would it be?
Take care of each other. When working in the NICU, it is a very stressful place. It is also a very high rewarded place to be. And we need to remember to take care of our coworkers, our friends that are in the next pod or in the next room.
Yeah, it really does come down to that. And Cheryl, what would you say?
Oh, from my standpoint, it is that staff education regarding taking care of families is just as important as staff education regarding taking care of babies, and that we are really trying to change the culture from the concept of just taking care of the baby to the fact that your care unit is the baby and the family.
Yeah. Well, thank you so much. This has been a wonderful conversation. I really, really appreciate you sharing your time and expertise with us. And for those of you who joined us today, I hope that it's been worth your time, and I hope that you'll go and look at the other webinars in this series, because we've had so many fascinating, smart, insightful discussions, and the people that we've talked to have brought just a depth and a breadth of experience that has been really, really helpful. I know it makes me a better advocate. And we mentioned some resources as we talked today. Of course, our two organizations, the National Perinatal Association and the Preemie Parent Alliance. We are both nonprofit, member-based advocacy organizations. We are always looking for passionate parents and professionals to come and join us in the work that we do. We also talked to you a little bit about some of the resources that are available to support the recommendations. And this website, Support for NICU Parents, is a great place to start, because you can go there, you can link directly to the recommendations, you can read them, but then there's also just a whole host of tools and resources and downloads to help you kind of evaluate where are you and your organization or your unit at with delivering psychosocial support. What could you do to improve? How would you take on a quality improvement initiative? And there's so much good stuff there, all the evidence, good cases for support. So we hope that you'll take time to look at that. And again, it was so important that these recommendations not just be a document, but that they be a movement. And part of that has been recognizing, like we talked about today, how important it is to educate our providers and educate our staff. So there is a whole online course based on the recommendations for psychosocial support that we have partnered on, our two organizations, to bring awareness, to provide the curriculum, to give people the forum in which to discuss this super critical and important aspect of care. So if you are interested in bringing that sort of education to your NICU, or if you're a parent advocate and you would just like to know more about this, please contact us at mynicunetwork.com, and we can help you get connected with the education that you need. You can go and look at the course directly, and I believe there are even some sample materials at mynicunetwork.com. This is the collaboration that we've done between the National Perinatal Association, the Preemie Parent Alliance, and Patient Family Care to bring you these online accredited courses. If you are interested in advocacy, if you do this sort of work or want to do this sort of work, there's no better organization that you can be a part of than the Preemie Parent Alliance. Whether this is a group that has brought together parent support programs from all across the country, started by parents, run for parents and families, led by families who have had NICU experiences. We meet together, we share best practices, we talk about how to support each other and to support the staff that take care of our babies. Every year there's a summit. This year, Denver, Colorado, but this happens on a regular basis. And if you just go to the Preemie Parent Alliance website, you will find out how to get connected. You'll find out what's being done. And it is really, if you're just starting out, this is the shortcut to creating amazing, fantastic evidence-based programs as quickly and as well as you can. We also invite you to please consider becoming a part of the National Perinatal Association. Whether you're a parent or provider, there are opportunities available to join initiatives, to support efforts like this that are done by our Family Advocacy Network. The National Perinatal Association has within it some of the longest running NICU support programs in the nation. It's a chance to talk to people who have done this work, who have dedicated their careers to it. It's a place to both find mentors and to mentor, to meet people, and to work on these sorts of projects that really, really matter to us. It's a wonderful organization. I could not recommend the National Perinatal Association more highly. We hope again that you've enjoyed this. We hope that maybe it's encouraged you or inspired you to go look at some of the other materials we have, some of the other sections of this webinar series. You'll be able to find all of this information and more by visiting the companion site for this webinar series. It's going to be hosted on the National Perinatal Association site, and the address for it is www.nationalperinatal.org/NICU families. And we will compile all the webinars, all the materials, all the information, the bibliographies, and in many, many cases, ways to contact our hosts and our presenters so that you can learn more and continue this discussion. So we just want to thank you again for joining us. We appreciate you. Thank you for the work that you do every single day to support parents and families.